Good afternoon, everybody. It's 5 o'clock.
Not in this vehicle, no.
I'll call the meeting to order of the Health and Human Services Board. And we'll do a roll call.
Dr. Anwar?
Present.
Julie Smith?
Present.
Lisa Lind?
Present.
Sean Anderson?
Present.
Kathy Leaf?
Present.
Dave Osnes? Present. Greg Telejohn?
Present.
Mike Barkalow?
He's excused.
Okay. And Deb Lindeman?
And we'll welcome Julie Smith. This is her first meeting, so we expect her to know everything.
Yeah.
Uh,
Thank you.
Thank you. Is there any objections to the minutes that were presented with the packet or any corrections? If not, they'll stand approved as presented. The minutes are approved. We have a general public comment, not the public testimony, but public comment on any subject other than the Health and Human Services budget. Is there anybody here from the public who'd like to speak? Anybody from the public? Here, seeing none, hearing none, we'll move on. Business items. Now we have the open public participation process, review letters, and take public testimony related to the 2024 Health and Human Services budget. I have one here I will read from John Groen from St. Croix, or from Spring Valley School District. He's not able to be here and asked to be read. My name is John Groen. I serve as superintendent of the school district of Spring Valley. We have approximately 750 students enrolled. These students and their families reside primarily in Pierce, St. Croix, and Dunn counties. I'm writing to you and the department to provide testimony regarding the development of your 2024 services and budget plan. Thank you in advance for your consideration of the comments and perspectives from our school district. We both share a united vision in ensuring residents and/or students are healthy. In recent years, for a wide variety of reasons, the mental health needs of students have increased significantly. In our district, the pressures of the home, the demands of school, and the ubiquitous nature of social media have combined to create a crisis for some. We've seen students at younger ages begin self-medicating with nicotine and THC, primarily through vaping products. Using internal surveys, we were able to determine that between 11 to 19% of high school students don't feel that they have a trusted friend or an adult to share life's challenges. I strongly encourage St. Croix County to invest in mental health supports for students and families. These dollars have a very high rate of return as timely support keeps students in school, parents at work, and improves the safety of communities. Spring Valley students and families run into issues with insurance or access due to living close to Minnesota. While there is an abundance of providers in Minnesota, however, insurance coverage remains a challenge. Patients in Wisconsin are not able to access telehealth services across state lines. So for any students who may be waiting or needing that, they have to drive to the Twin Cities or find a different provider in Wisconsin, sometimes hard to find. Any expansion of services supporting mental health would be a welcome news and make St. Croix County an even better place to learn, work, and live. Thank you for your work. We appreciate it. John Groen. I believe Jennifer Griggs wants to address.
Hello, can you hear me?
Yep.
Yes, my name is Jennifer Griggs-Andrus, and I am the Executive Director of Family Resource Center, St. Croix Valley. So dear honorable members of the Human Services Board, I would like to thank the St. Croix County Human Services Board and Human Services Director Bob Rorett for the invitation to share how valuable services provided by Family Resource Center, St. Croix Valley make a positive difference in meeting the needs of at-risk children in St. Croix County We have a long history of collaborating with St. Croix County and a long-standing, strong partnership with Bob. I'm not going to read the whole letter, but I just want to highlight some of our services from 2022. So in 2022, we served 60 St. Croix families, 180 individuals, enrolled in parents as teachers, home visiting, and provided 782 twice-monthly home visits. We visited 418 families of newborns at 5 partner hospitals. In our 3-county service area, we engaged 513 individuals in our group connections. 59 individuals participated in multiple special events, including Understanding Emotions, Flex Gymnastics, Author Book Reading and Signing, Crystal Ball Dairy, Threshing Table Farm, White Pine County included 7 virtual classes, including 4 Baby and Me series, 1 early childhood education series, 2 triple P discussions. We held 14 in-person sessions, including 4 Play and Learn series, 1 5 for Family series, and 1 author event. We also did a meal for Hispanic families and 5 special events. Triple P seminars were also offered virtually on a weekly basis to inmates in St. Croix County Jail. So we want to thank you early for your support of the 2023 initiatives to train community partners, parent partners, and staff members in Recovering Together cafes, and we greatly appreciate that partnership. So on behalf of our outgoing Executive Director, Agnes Ring, and the entire staff of Family Resource Center, we would like to express our appreciation for the financial support of St. Croix County, the opportunity to work with you, and in the front lines with families, focusing on attitudes, beliefs, and behaviors of the adults who surround our children. We ask for your continued support. You're a valued partner, and we're here to explore ways to continue to strengthen families with young children. Thank you for your consideration, and I welcome any questions you may have.
Is there any questions? No? Thank you very much.
Thank you.
Next is there Elida Peterson? No? I have a form here saying she wanted to speak.
She submitted a form that she was going to come and present tonight, but I don't see her yet, so
We'll submit-
maybe we move on, and if she
Yeah.
shows up, we can come back to it. I don't know, I know she's busy, so,
Okay.
but,
Is there anybody else who'd like to speak? No? Well, then that will close the open public participation right now unless Ms. Peterson shows up. Next, I'm privileged to introduce Peter Kildee from WestCap, the Executive Director of WestCap. He's going to talk to us about WestCap and housing and who knows what else he'll talk about. What? Oh. Yes, yes.
we're going to skip to it, so if you're ready. Perfect.
You don't even get a break, sorry.
Yeah.
Okay, great. Well, thank you all. So, Ailey Peterson, CEO for Western Wisconsin Health. Apologies for being late. I just am here to give a public comment about how much we appreciate the funding that we've received at Western Wisconsin Health for our medication-assisted treatment program to help care for those suffering from substance use disorder. So just want to encourage this ongoing partnership. Again, appreciate the support that we've received. Bob has been a great partner. And so happy to answer any questions, but mainly just wanted to lend my support for the funding and hope that it can continue.
Is there any questions for Ms. Peterson? No? Thank you.
Great, thank you.
Now the great Peter Kildee.
Yeah, you can just skip through that if you don't mind. So very happy to be here tonight and have a chance to tell a little bit about what I call the WestCap story. and mention a couple things about our request to the county. So it's a lot of information. I'm going to do a little bit of a lightning round on our usual overview because a lot of people don't really know all the things that we do. It's a pretty complex program. And then save some time. It's my understanding folks are particularly interested in issues around housing and homeless stuff. Some of that's in my presentation. Erica Shook, who is our homeless intervention manager, will be taking the stage here a little bit and talk about those programs and then any other questions you might have. So first of all, West Central Wisconsin Community Action Agency, WestCAP, is one of 1,000 CAPs around the country. I have the privilege of serving for 18 years now on the national board of the 1,000 CAP member organization, so I'm pretty versed in it. Our particular mission is to take action against poverty by developing the social and economic assets of low-income families in their communities, and this is important, by working to create a more just and sustainable society. So we're actually funded for that kind of work as well. It's not just dealing with what I would call the victims of poverty, but also spending some time and resources addressing the systems that perpetuate people in poverty, and I do quite a bit of that work personally. So a little bit of a history and a little bit of an overview of community action. We go back to the sort of Great Society, programs that came out of the Johnson administration, like Head Start and foster grandparents and all kinds of other things. We were the second community action agency to actually be founded in Wisconsin out of 16, going back to 1964. And we have a 21-member board of directors. And I just want to say a couple words about that because it's really a unique structure that is mandated by our core funding that our board does not, and our staff does not pick its board members, So St. Croix County, because we have a requirement that 2 elected officials from every county that we operate in, or 1 elected official, serve from each county, and the counties just send whoever they want. And we have that person. So it's Greg Telejohn at the moment. We were served very ably for many years by Dave Engstrom prior to that. And kind of ensures that we don't become an insular bunch of people who just kind of think alike and whatnot. We have people of all kinds of political stripes and backgrounds. The other 2 positions from each county, one is a low-income person with lived experience, and they're elected by other low-income people. So we don't pick them either. Then the third thing we do is the board picks an organization from each county to be a community representative. We pick the organization, but not the person. And again, they send whoever they want. And that, I think, is one of the main reasons why we've been weathered all kinds of storms. And, 60-some years later, or almost 60, we're still here and engaged in these communities and doing more stuff, in our case, in most community action agencies than ever before. So, I happen to be the 3rd executive director in 58 years. We're very stable, and staff like our work. We have a very stable and experienced staff as well. So like I said, we are a community action agency. We're a private nonprofit, and we're also very involved with other CAP agencies. So last week, I did a groundbreaking thing on a 60-unit affordable housing project in Eau Claire that we're doing with our sister CAP, Western Dairyland. They got us in there because of our housing development experience. We'll talk about that a bit. But the programs that we work on are largely around housing. I'll talk some more about those specifically, but also food security, energy and energy assistance, transportation, and basic needs. We're just trying to help people cope with being in poverty and when we can to get out and become self-sufficient. We serve these 7 counties. We also have been doing some programming in Burnett and Washburn counties and some specific programs. But our board, the 21 members, are 3 people from each of the 7 counties in this primary service area. Our annual budget is around $18 million operating. The annual report, which you I believe received electronically. I have some hard copies. talks about a $27 million budget and a $25 million economic impact. It all kind of depends on what you're talking about. But when it comes to the operating money that we are using, it's generally around $18 million a year. And in the last year, a little over 30,000 people, either directly or indirectly, were recipients of our services. So an indirect example would be we administer the TFAP contract, that's the Emergency Food Assistance Program. And so we manage that thing and make all those arrangements and that kind of stuff. It's pretty complex, but that in turn serves over 40 food pantries in our area and several food kitchens and that kind of thing. So, you know, that would be an example of indirect. Most of the rest of what we do is direct service. So we have a number of challenges. If on the Human Service Board, if you have an opportunity to go on the United Ways, United for Alice, Wisconsin site and dig up their ALICE reports. ALICE is short for Asset Limited, Income Constrained, and Employed. And it's the best picture that I've seen of what economic hardship really is about. And according to their analysis, which, you know, they basically define poverty is living in a household that cannot afford a survival budget without public assistance. I think that's a pretty good definition. I buy that. So, you know, the official poverty rate's about 11%, but if you're in the field, you know that that's ridiculous for reasons I don't have time to go into, historical mostly, but it's way out of whack in terms of real economic hardship. But this tells a good story. And they drill down to often the township level in the county or in the state. So you can find out exactly what the story is. Confession, I also serve in their advisory council and am somewhat of a fan. I'm also on the advisory council for the national United Way Alice thing. So the other challenge, I call them lies, damn lies, and statistics. I hope you recognize that as coming from Mark Twain. Just to give you a sense of what that looks like, and I'm using 2018 data here because I didn't have time to dig up the current, but it's almost exactly the same. So the official poverty level there in the left side column, St. Croix was like 5% in 2018, and if you use the definition that I'm looking at of people who are unable to afford a survival budget here based on their income size and or house size and where they're living, it's 27%. Statewide is even higher than that. And that's part of the thing we're up against. People, for very good reasons, saying, well, poverty is only 5% in St. Croix County. What's the big deal? It's an inaccurate number is the big deal. It doesn't capture the reality at all. So just to give you a little sense of why that is, you know, they put a measure in place in actually the late 50s that was fairly accurate at the time, but they used kind of the standard consumer price index and that kind of thing to adjust it. And the real costs of that population tend to go up way higher than the calculation for that. And so by this time, 50, 60 years later, it's so out of whack, it doesn't work. And I've taken a really good hard run at trying to change that and ran into a brick wall in Congress. So there you go. So program eligibility, we use mostly household income. A lot of it is still based on the federal poverty guideline, but anybody who does these programs know that it's 200% of poverty for one program like weatherization. It's 300% for community health and child health and that kind of stuff. Nobody actually uses that number much. A lot of it's at 150 and 125% and whatnot. But what we like a lot and advocate for is using county median incomes, because that is very specific, it's accurate, it's not a calculation that you can change and get out of whack, it is what it is. So we're generally serving people at 80% of county median or less. On average, we're probably around 50% as a rule. So the kind of things we do a lot of stuff in housing. We do apartment rentals, homeless programs. We run Section 8 in a couple counties. We do emergency rent assistance. And then we have food access and resources. I talked about that a little bit. Weatherization, we were actually the first federally recognized weatherization program in America. Now there are like 800. Always been a pioneer, and we've always done pioneering work in that area. Right now, we're probably weatherizing around 400 homes a year with our own crews and that kind of stuff. It's a big deal. We also do some adult education. We provide energy assistance now for 9 counties. A lot of the counties we're doing that. And then we keep working on transportation things through car ownership and a few other programs that come together. That's a real tough nut to crack in this part of the world. So a little bit more on the weatherization. This is highly scientific, regulated program. We use sophisticated equipment to measure all kinds of things in a home. Do a computer analysis. It tells you exactly what measures are cost effective and what aren't, and it really is quite elaborate. And our folks do a great job. We get more thank you letters from this program than just about anybody. People say, oh, my house is so much more comfortable, it's saved so much money, all that kind of stuff. We get these lovely letters for this program, and we should. Lately, we've been doing a lot of housing development and management. We were in the housing development business pretty thoroughly for 8 or 9 years, and just determined after a couple of tough situations that we couldn't take that risk and put our other programs at risk. And a few years after that, I got contacted by a for-profit developer, and I knew a little bit about the company. They do nice work, and he wanted to work with us because of our reputation on service delivery and all that kind of stuff. And I said, okay, you take the risk, I'm on board. And he said, okay. And that was the beginning of actually a wonderful relationship. And we've done, about 600 units with that organization, and some of those have been very cool. Here's a few that are in St. Croix County. Upper left is in New Richmond, our Dakota Meadows project, Havenwood. We also manage the senior project that's in Glenwood City. Middle left is North Hudson here, Abbey Grove project, 35 units. The one just to the right of that's BB Lofts, a senior project in New Richmond. Low and to the left is a project called Hammond Homes in Hammond. We just last week got a $100,000 grant to upgrade the energy systems to renewable energy and all that kind of stuff. We're very excited about that in our Hammond project. And then in the lower right, this one is technically in River Falls, but it's so close to St. Croix, and I wanted to bring it up for that reason and because this project has gotten us a tremendous amount of attention. This award here under 1,300 residences is actually the top national award in the category for green and healthy housing in the whole country. Came to this project last year. I was out. Congressman Kine presented the award. It was a really big doings out in D.C. The governor's been there, really likes the project, and this has really generated a great deal of interest. But the cool thing about this is that 70% of the energy costs in this facility is free. We don't have any energy bills to the residents there. There's a single meter for the whole place. There's no plug load, separate metering at all. And folks love it. I mean, it has really been extremely successful. And that's kind of the model that we use. So I talked a little bit about our food access and resources, 40-plus community-based food pantries and whatnot. We also run a senior farmers market voucher program where we just get the vouchers. We have to bring in the money to run the program, and that's where things like the $5,000 we ask from St. Croix County come in because the other funders just don't pay it. We run a commodity supplemental food program where we're boxing up food for people that are shut in, and they're wanting me to shut in their houses, and get that delivered out there. And we also run a community farmers market in Menominee, and that's actually been a pretty cool thing too. We have an adult education program. It's literacy, which you do understand. Skills enhancement is a program developed by another CAP agency about 25 years ago to help people gear up for a better job. So it's support for childcare and uniforms and books and all that kind of stuff while they're going to school. It's a little tough to manage. We also, just this year, got a new grant just given to us because of this very successful program, helping low-income folks prepare for a medical career. And that's a very substantial grant, and it's working out extremely well. And then we do some community-based projects. We have our own holiday gift drive, do back-to-school supplies, and these are basically things that our staff does more or less as volunteers. They're not paid extra for it. They just take it on when it comes Christmas, and it's a great thing to do. Finally, I want to end tonight with housing assistance. And again, so I've brought our homeless intervention manager, Erica Shook, talk a little bit about that. And I would say before I turn it over to her, again, I want to grab a copy of this. And at any time, if you have any questions about what we do or concerns about how we do it, or you're hearing anything, please reach out to me. You know, I'd love to, you know, help you resolve it or respond or let you know what's going on and that kind of thing. So always open to do that. Always appreciate the opportunity to get in front of good folks like you to tell our story. And with that, I'll turn it over to you, Erica.
Hello, as Peter said, my name is Erica. I'm the Homeless Intervention Program Manager with WestCap. To talk more specifically about our supportive housing programs, as you can see up there, obviously our goal is to help achieving safe and affordable housing for homeless families that are dealing with physical, medical, and daily living needs. And then, of course, developing a long-term plan for stability, because always our goal with our programs is that we see these individuals and families be able to sustain on their own without assistance or with minimal assistance moving forward. So first, I'll just kind of go through. So our permanent supportive housing program it's a long-term assistance program, so there's no time limit for families or individuals that are on this program. The requirements is they do have to have a documented disability and be chronically homeless according to HUD's definition of homeless. And they must be literally homeless upon entering the program. So with this one, it's kind of unique. So WestCap actually holds the lease for this program, and the clients sublease from WestCap. It kind of opens up the door a little bit. A lot of the clients that we see on this program have, they're chronically homeless, so they've been homeless for 12 months or more, or 12 months in the last 3 years. So a lot of them we're seeing high barriers with them, criminal histories, mental health, alcohol and drug abuse. Usually dual diagnosis clients that we're seeing on this program. So that's why there's no time limit, because it just takes them longer to get kind of back into, maybe they need to go through another treatment or they need to get connected to mental health services. And that all, as we know, takes time when you're trying to find providers and things like that for clients. So on this, they do pay 30% of their adjusted gross income that goes towards rent. And that ends up, WestCap pays the full rent to the landlord, and that 30% then the client pays back to WestCap. And case management for this is weekly. So we have case managers in there every week with these clients working on very client-centered goals. So starting where they're at, what do you need from us? How can we help you? How can we connect you to services? So very intense. This program is a very intense one for our clients. The next one is our rapid rehousing program. This one does have a limit of 2 years. Generally, the clients that we see on here are a little less high barriers. So maybe it was somebody who got behind with medical bills, lost a job. Over COVID, we saw some of that where they lost their job for a while, got behind in rent, got evicted, so now they just need a little help getting back on their feet. They do not have to have a disability for this program. They do have to be literally homeless upon entering the program. On this particular program, the client themselves holds the lease, and then WestCap helps subsidize the rent. And it's the same as 30% of adjusted gross income goes towards rent. And case management with this one is a little lower depending on the client's needs. It's a minimum of monthly, but we have had clients on this program that say, can you come every other week, or can I see you every week for a while until I'm feeling adjusted on the program? So it really is very client-centered as to how we do case management. And then the next one is our TBRA program, so that's tenant-based rental assistance. This is a 2-year program as well, with the possibility of an extension if the client still or family still meets requirements. And this one's a little bit different because they can be homeless or at risk of becoming homeless. So if they have an eviction notice, say they're behind in rent or something, and the landlord's given them an eviction notice, we can work with clients to get them on this TBRA program. And the same client holds the lease with this one, and 30% of adjusted gross income goes towards rent. Another little difference with this is the case management is done monthly, but through outside agencies that we work with. So it could be like human services or different agencies in the area that work with the client's family support center, things like that, have done case management with them. And then the last up there is our, well, under this service is the transitional housing program. This is, again, a unique program. This is located in Dunn County. And it was actually, we were approached by Dunn County to run this program. They had received funding and asked us to oversee this program. So this is very specific to clients who are coming out of jail, prison, or rehab who don't have anywhere to be. So, and of course, their risk of recidivism is very high because they don't have anywhere to be, so they go back to those old behaviors, what they know, and it usually ends up them returning back into the justice system. So they do have to be referred by an agency. Usually we'll have, the jail will contact us with people, or treatment court has contacted us with clients for that. They get housing for a year, and they don't pay any rent or anything like that. They're there. They get to start from the bottom. They work with a case manager. Case management is usually bi-weekly or more if needed. And it is a shared housing, so that's unique as well. So they have their own room that locks, but then they share all the common areas. So it's unique. It's been a little bit of an adjustment, us learning that, because our other programs are not their individual houses or apartments for the clients. So that was a little bit of a change for us to adjust to. And then they have the housing choice vouchers. I don't personally oversee that program, but I can tell you they do have a lot of clients and always a waiting list, unfortunately, as with most Section 8s in most counties. But they do great work as well. So it's the same type of program. They subsidize the rent for the client, and the only difference is there's no case management. So these are generally people who are, pretty high functioning that don't need a lot of follow-up from a case manager. So currently, kind of right now, between our PSH Rapid Rehousing and TBRA programs, we currently have 34 households in St. Croix County. It is one of our highest serving counties. A lot of people requesting to be housed here or have connections here from the past, or a job or something that they want to be here. So it is one of the counties that we see a higher housing rate in. And I don't have specific numbers on our waiting list, but I know for our prioritization list, it's a daily, we get daily calls on people that are in need of assistance for housing. So that is all I have. I kind of ran through it quick. Does anybody have any questions?
Any questions? Yes, Kathy.
What is classified as a household? It can be families, so we're not talking 34 people, we're talking households, right?
Yeah, so we don't determine, we don't tell them what their household has to be. Obviously, if somebody were to come in with that large of a group, we would try to, okay, we need to split this up. But a household could be a single individual, it could be two adults with children, it could be a single adult with children. So there's a great mixture. So I just say household because when I say individuals, people think one, and it's not, it's not always. There could be multiple people in the household. So thank you.
Go ahead, sure.
On your transitional housing in Dunn County, is that just for Dunn County residents?
People can send referrals, and I can get you specific information for that.
Okay.
They just have to be able to get to Dunn County or to Menominee. The houses are in Menominee. So.
Okay, thank you.
Any other questions? Dave's awful quiet. Gee.
Well, I guess, I don't know.
Or me
Go
or
ahead,
Peter,
go
that
ahead.
is either.
I guess another question is, we hear this information and then you feel like, okay, we know there's a significant problem, but we're wondering what we can do. I always feel helpless around this issue, especially.
Yeah.
So I don't know what things policy-wise or as a county or, what we can do.
Of course, always, as funding is always, helps us be able to provide and support the clients in this area. one of the biggest needs we see, and I know this isn't something that you guys can probably solve, but it is the lack of affordable housing right now that we're running into, and it's across, it's not just, yeah, it's not even, and we're seeing it across all of our 7 counties that we're covering, so it is not just an issue here, but so even with us being able to enroll clients on our program, finding a affordable unit for them, because landlords have raised rents over the fair market rent, which we have to follow for our funding. HUD sets those limits for us, so that's an issue. I don't know, Peter, if you want to add anything in there.
Well, I just have one thing. About 90% of West Cap's money is covered. And it's local and county and state blended and all kinds of our rental income, these affordable housing projects. When I was talking about very high quality housing, but it's a tremendous amount of support. That's the thing to do. We also add funders.
Go ahead, Dave.
Peter, I'd just like to thank you and the entire West Cap staff and all the workers that you guys bring along with everything that you do. You guys have made such a huge difference to our particular area and to the folks that really need the help. The door is always open. Somebody's always there to answer the phone. You'll have an answer. I will guarantee you that. I've seen it firsthand when I've been over there, all the good stuff that those guys do, and my hat is off to each and every one of you guys for an outstanding job and the great work that you guys do. Thank you.
Thank you, David.
We appreciate your support as well.
The other thing we're looking for too is, come wintertime, emergency housing and, shelters, and there's just a lack of that. And how do you get something like that started in particular areas? And that's an open-ended question.
Well, I have sort of a closed-end answer. The state has got some money to do affordable, to do housing development for people that are either homeless or almost zero income or high risk, that kind of thing. And they are very soon, they've been working on this for months, and we have been encouraged to apply for that. So in that application process, in order to, again, get these kinds of things into your community, they will be looking for, letters of support, signs, a clear signal that the county wants that or the town wants it or whatnot. And that's what really makes it work, and if that is there, I'll certainly reach out to you, and actually we're talking, I'm looking at maybe doing 2 sites if we get the funding. One would be St. Croix County, specifically because of that need for homeless, for that kind of housing.
Right.
So hopefully we can give you a real answer to your question.
Good. And remember, they're located in St. Croix County in Glenn City is their headquarters, so isn't that far away, just on the other side of the county. So, thank you, Peter. Thank you very much. Next is the public health updates on the 2023-2025 Public Health Strategy Plan and Community Health Improvement Plan.
There is one slight misprint on the agenda. The agenda item reads 2023-2025 Strategic Plan, and that actually is the CHIP. That is the Community Health Improvement Plan. So I just wanted to make that note. Not a huge deal. Thank you for having me tonight. I I know this was a requested agenda item. We'd like to talk and give the board updates. We are an accredited health department, which means that board involvement and informing our board, our Health and Human Service Board, about different initiatives we have is one of the things we need to do for keeping our accreditation status. So I believe it was I guess you're not a supervisor. Ms. Lindeman requested the CHIP update, and I did want to just be able to give you just a real quick update on our strategic plan as well. So I have,
Are you guys able to see that in your packets? For whatever reason, it's not loaded in here, as you can see. Bizarre.
okay.
Okay.
I have it on mine. It's just not on that one. Well, it's not a ton of slides. It's a lot of slides with writing. I can talk about it. Yeah, I certainly can. So one of the things with community health assessments and community health needs assessments, hospitals refer to the assessment as a community health needs assessment. In public health, we refer to community health assessments. Public health has been doing community assessments for years and years, back into the 90s. And then with the Affordable Care Act, when that was put forth into law, nonprofit hospitals had to start assessing their communities or the people that they serve. So hospitals and public health departments teamed up to do these. I'm just giving you a little history because I know some of you know this very well, and some of you might not, for people who are newer on the board. So the community health needs assessments, hospitals are required to do them every 3 years. Public health doesn't have that actual requirement, but we do partner with our hospitals, every single one. Ailey is here today. She and her team over at Western Wisconsin Health are amazing partners for us in our Healthier Together Coalition. The Healthier Together Coalition is the coalition that really does this work and the community health needs assessments. So that's kind of a brief overview of what the assessments are. I did decide to do a few goals or accomplishments. So obviously with COVID, public health departments and hospitals were very, very busy, taking care of sick people, contact tracing, doing COVID-like things, and really the work that public health does, specifically like community health assessments, kind of took a back door. However, we partner, St. Croix County partners with Pierce County. So it's a 2-county collaborative that does these community health assessments and then puts them into a community health improvement plan. We were able to do a community health needs assessment in 2021, all while still finishing up the previous cycle of the plan. So these are cycled plans. They go every 3 years. It's quite intense. We like to get community involvement. I always say, I really wonder how many people in St. Croix County or Pierce County know these even exist, right? We don't do a ton of PR on them, but I think the people who do know really do find value, and the people who are part of the coalition really are long time standing members of the coalition. So I don't know if you want me to read. I mean, that's a lot of bullets. I'll just hit a few of them. So accomplishments while we were finishing up, while we were in COVID, so 2020 to 2021, we completed Narcan training, 73 in Pierce County, 38 in St. Croix. We secured ARPA funding to expand early intervention, community-based interventions involving law enforcement and criminal justice involved individuals, and I think you guys have heard about that program that we have. It's I think, proving to be a success for us here in St. Croix County. We continue to provide mental health and substance use disorder services using tools throughout the pandemic, and we hosted substance use disorder forum. We're going to hold that in May. St. Croix County is every year, so we just recently did on May 17th our second annual mental health symposium. Some more accomplishments. I think this one's big, and you actually heard public comment tonight saying from Spring Valley how they enjoyed the partnership or maybe not rely, but really have a partnership with Health and Human Service. You know, they may not be directly referring to, that's okay, you're fine, I could do that, referring to Healthier Together, but Healthier Together, our coalition does have a group that meets with school mental health providers. We provide mental health first aid trainings to schools. 3 youth mental health first aid staff were trained in Ellsworth School District. So we're really trying to work a lot with school districts and get them. There we go. Okay, you can go. There we go, and the next one. And so this isn't in the packet. We'll add it to the packet. It is? Okay. Okay. One of the things, I'm not going to read all these now that you can see them. So one of the things that's really become a big push, I think, in our healthcare system as well as public health is really this, this concept of health equity and what health equity is. So Healthier Together really did try to make an effort to say, is health equity infused in our work? And health equity doesn't mean everyone's treated equal. Health equity means meeting people where they are at. As you heard from WestCap today, we have a spectrum. Our population is definitely, we don't all need the same thing, right? We don't all have the same kinds of needs. So really looking at meeting people where they're at when it comes to healthcare and when it comes to their healthcare decisions as well. So sorry, I'm recapping. So if you can go to the that one. There you go. So in 2021, with the help of Pierce County, so we have a leadership team. This Healthier Together Coalition has a leadership team that does, performs a lot of we're the backbone organization, we call it, or a backbone group that really gets a lot of this work done. So we designed a community health needs assessment, and we gave the assessment out. Only 1,000, well, close to 1,100 people took the assessment, and just about what you figure as far as our population goes, about 40% from Pierce County, 60% from St. Croix County. One of the things we always try to do better at, it seems like white, female, middle-aged women will take any survey. Take any survey that they're given. We really wanted to do better at getting a more diverse sample of people answering our assessment. We'll continue to do that one as our future assessments come up. But this is what our results really showed in 2021. So it's probably hard to see. 2015 is over here, 2018 is in the middle, and 2021 is there. We had a variety of different questions, and really the top priorities that really came to the top were mental health, no surprise. I think mental health lives on every community health improvement plan across the state. You'd be hard-pressed not to find one. But this affordable housing, which is interesting, that we just had the presentation related to affordable housing. I think the members of Healthier Together and people in the community really realize that affordable housing and housing in general is a huge issue in both Pierce and St. Croix counties. So once you get this assessment, we also had focus groups with different populations in Pierce and St. Croix counties that were ran by our Healthier Together leadership people. And we listened to what the focus group said, and really we came back and said, can you flip the next slide? So this was, this was the stakeholder. We reviewed the survey data. We looked at secondary data. I don't know if these links work, so we better not click on them, but we wanted to, prioritize these top two concerns. With that housing being there, we really wanted to take a look at making when we defined our health priorities, so after you make your assessment, you define your health priorities. And these health priorities, I think the year before they were substance use disorder and mental health. Pretty specific, pretty generic. We as a coalition wanted to really open up and make our health priorities kind of more broad. So we could possibly, as different initiatives come up or different grant opportunities come up, because there's no money tied. Let me just be very clear. There's no money tied to community health assessment. We get no money to do this, and we are always having to look for grants to do this work. So one of the things, if you can flip to the next slide, like I said, we wanted to broaden these areas. So we still have, mental health, but we decided let's take a little bit broader scope and say mental, social, and emotional wellness, because I think we all realize that mental health is just one aspect of our health. There's a lot of different pieces of our health, and certainly social and emotional health and wellness is something we wanted to encompass. And then because of the all the buzz and talk and want, I guess, for affordable housing and looking at housing, we decided that's very specific, and we don't know how much work we're going to get done, because affordable housing for a coalition, it's kind of out of our control, right? But we can do things like influence and, talk to stakeholders, tell them, define the problem, think about solutions and creative solutions. But we wanted to make this priority just a little bit broader. So the things that are being addressed for affordable housing by the coalition fall under this health priority, thriving and livable communities for all. We can also do other things under that initiative. People were concerned that we lost our substance use disorder priority, and we didn't. We still do a lot of the substance use disorder initiatives under thriving and livable communities, because we think that fits well under there. So, okay, next slide, please. Okay, so do we want to just do any questions about the community health assessment before I do a strategic plan? Strategic plan's very short. I just want to make sure I update you. Okay, you might think of some. Like I said, we are a level 3 health department, St. Croix County, and one of the things that we're also an accredited health department. One of the things we must do is the community health needs assessment, the community health improvement plan, as well as a strategic plan. And there's other plans that we do. Strategic planning to me, though, as an administrator or manager in the county, is so vital and so important. I remember one of my first days as health officer here, I think we were in an all-staff meeting, and I asked staff, do you know our mission? Do you know our vision? And And you wouldn't believe how many people didn't know it. But I didn't know it either. I had looked it up when I went to interview. But I really feel like strategic planning really should drive the work we do in public health. And we just finished a strategic plan at a department level as well, so the Health and Human Service level. And then, of course, the county has a strategic plan too. We wanted to make sure these were all aligned, so we weren't on a wild goose chase, chasing other initiatives. So we made sure we kept the county's strategic plan in mind. Okay, so here's just our org chart, which I thought was important. I'd like to go back, sorry. No, you're fine. I just want to point out that for a county our size, the fact that we have 18.5 staff, it's small. Most counties with the jurisdiction population size have over 50 employees. So we are a small health department and we do a lot of great stuff. We got the addition of our epidemiologists through COVID, which was amazing, as well as a health educator, which I think you'll, as a board and hopefully as the county, will be able to really see the value in those two positions that were added to our public health department. Okay. So one of the things that we did, strategic planning, there's no blueprint to do strategic planning. There's different people you can purchase for service that come in and can do a strategic planning session with you or your team. And we really leaned on our UW Extension partners during this last round, and I was very happy with what the UW Extension folks did. This actually was over a year process. Lori Diaby and I, who is the public health supervisor, we started planning with UW Extension back in 2022. They took their time. They showed us a bunch of different tools that we could use with our community as well as our staff to really say, let's get to the bottom of, what is St. Croix County Public Health all about. So one of the things we did, these are kind of the purposes for this strategic plan. And then if you go there. So this is really kind of the process. So we engage, like I said, with the division, and they aren't, UW-Madison Division of Extension. They've changed their name a little bit. They really, like I said, facilitated this process with us. We did actually send out a survey to a lot of our stakeholders, including schools, hospitals, clinics, chamber members, St. Croix United Way listserv. We sent a survey, a stakeholder survey out, and it did go to 300 different community partners. We actually did have a 30% return on investment or return response rate on that survey, which is actually really quite good. And I was a little bit surprised. So once we got that survey, or once we got the results from that survey, Lori and I sat down because there were questions related to prioritizing what should St. Croix County Public Health be doing in the recovery during COVID or after COVID. And you can see, well, this is the timeline, so you can go back and look at that. But if you go to the next slide. So this was the 300 that it was sent to, and these 5 things, I didn't bullet these statements, but these are the 5 things that came to the top from the community survey that they thought public health, St. Croix County should be doing. So addressing health factors and health equity for all at both of a population level as well as by providing foundational public health services, and these are in prioritization order. Anticipate, prevent, and mitigate health threats in the community. I think that's good. That's a cornerstone of public health. Improve, innovate public health functions through ongoing evaluation, research, performance management, and quality improvement. Communicate and educate effectively to inform stakeholders regarding health, the factors that influence it, and how to improve it. that was really good. And the session we just had, when we kind of did that big overview of our COVID response, one of the supervisors made a comment, and it was like, it was such an aha moment for me, like, and it was related to communicating to the public. And it's like, I think his question was very simple, but did you communicate that? Did you know that? And I thought, wow, you know, after 3 years of constant communication, Adam, my right-hand man with forming and helping communication, it was about a specific issue, and I can't even remember what it was at the moment, but it was like, yeah, something that seems so easy. Was it really this specific thing communicated effectively? So I think always continuing to think about how we do that and how people perceive that as well. And building and support a sustainable, diverse, strength-based public health workforce. Public health is a field that not a ton of people get into. I really encourage our staff and myself, our organization, to try to take students. I think it's so important that we get nursing students education in public health. I feel lucky. My nursing program offered quite a bit of public health, where we know 2-year RNs don't get a public health experience, more of a community health experience. So looking for creative ways to always strengthen and get people excited about public health is what we're going to do under this goal. I really like that healthcare worker initiative from WestCap. I thought that was a really cool program. I didn't even know about it, so I'm going to absolutely look into that and see how we can maybe partner with them as well. Okay, next. So here are the goals. So we have these 5. So those last things on the slide, those last statements are our 5 strategic priorities. So this is how we did it. We engaged our public health staff with 2 working sessions with UW Extension, and they came actually more than twice. The 2 sessions really focused on our strategic plan, but one of the things we realized as coming out of COVID, we didn't spend a lot of time together talking about like how our response was, how we were doing, because we spent some time doing that with UW Extension during this year-long process, which was good. So staff submitted goals under each of these health priorities, and then Lori Diaby and I looked through all the goals, and we moved them around under each health priority where we thought they fit best. And then really we presented to our staff this early this year, January through March, what our strategic plan, where our goals were going to fit under these health priorities. And now the work of our plan is underway. I didn't add all the goals to this. I certainly can if people want to see them. It's quite a long document, so, but we certainly can share that. So, any questions on that?
Anybody have questions? Yeah, go ahead.
Is this, the strategic plan and the CHA and the CHIP, are they on the website, on the public health, on the county website underneath public health?
So the CHA and the CHIP are, and they are on not our website, it's the Healthier Together website.
Oh, of course, yes, okay.
Yeah, so we have our.
Is there a link to that from on our?
I don't know if there is a link.
I don't remember that exactly.
Because you have to do that for accreditation.
Yes.
There's a link to the Healthier Together website, not a specific link to the CHIP.
To the CHIP itself.
Okay.
And then as far as the strategic plan goes, Deb, it isn't linked at this second. We're still trying to figure out. So one of the things about strategic plans, you have to document and evaluate, and we still haven't decided like the mechanism. Are we going to just keep adding it to the base plan? But we certainly can get the base plan up on our website sooner than later.
Any other questions? Oh, go ahead, Dave.
Kelly, just to let some of the folks know, what is the process that you folks have to go through to receive that level 3 ranking?
Oh,
I know you
well,
could go, I know you could go on for a long time on that
I know,
one.
and I'm sorry, you guys, I try to be concise, and I'm feeling I'm not. Our level 3 ranking, so that's different than accreditation. So the state of Wisconsin, it's a department, DHS, it's an administrative rule. It's called the DHS 140, and that rule really governs what size health department you are. And then you have to make sure you fulfill all these requirements. So there's 3 levels of health departments in Wisconsin, 1 being kind of basic, 2 intermediate, and then 3 is the highest level of health department. So really right now what it means is you have a lot of programs. Your administrator has to have a certain degree of education. You have to employ nursing along with different nursing services. You have to have a lab. Our environmental health division, I think you heard from them last month related to fees, or we sometimes forget that they're also a part. I mean, they're a huge part of our health department, as well as our WIC staff and nutrition staff as well. So just it's a lot of programs and just documentation of the programs and how they run. And that is actually every 5 years, that certification. And we're coming due for that as well. That's our 140 review.
Any other questions? Go ahead, Kathy.
I just wanted to thank you for this presentation. I was involved with some of the early coalition stuff with Healthier Together, and it's so cool to see it all come together. Especially early on was when I was more involved, when we talked about the priorities. But this is really great and important work, and thank you for all you do with that.
You bet. I'm definitely not the expert in some of the Healthier Together stuff. Certainly, if you guys want more information, we have a really huge housing grant, the United Way, St. Croix Valley, and that is under the work of Healthier Together. It's a big grant that they're looking at affordable housing. They're doing some stuff with daycares, trying to get access to daycares. We know people can't work if they don't have daycare. They can't live or afford housing. So yeah, it is a really neat coalition. In fact, I was very impressed. One of the first nursing conferences I went to as a student, I believe Wendy Kramer, who is a former health officer of St. Croix County, and a gal from Health Partners presented about their partnership. That was before St. Croix County merged with Pierce County to do the coalition work. But I was just blown away. I thought it was, wow, that's a really cool partnership. And being young and nurse, thinking, wow, public health really does do a lot of different things. So.
Well, thank you. I
bet.
was involved also a little bit in Healthier Together in the beginning with some
Yeah.
interviews and so forth, so that was wonderful. But thank you for all your hard work.
Thanks. Thank you, guys.
Next is Health and Human Services monthly financials.
Okay, I'm on. Okay, so the financials are included in your packet. You can see them online. I'm just going to skip to a couple of the different departments. I just have a couple of areas that I wanted to point out for you. So if we go to page 52 of our packet, and we'll look at behavioral health revenues. One of the things I wanted to mention, so we had a couple of open substance use positions. One of those positions we actually transferred now to adult protection and filled that with the case manager to help with the significant need we had in that area. So we still have one open position that's currently advertised right now, but you will see that impact the revenues we had budgeted from the services that we provide and the collections we get from that. So they'll be a little lower than anticipated, but that will primarily be offset by not having staff within that area. The other area, the AODA DOC, that was our intensive outpatient program, and that has moved to Programs for Change. So that was our Department of Corrections grant. So we won't see any probably additional revenue for that unless there was just a little bit coming in yet. You'll see there was kind of a, when just comparing May of 2022 to May of 2023, under the mental health revenues, that's kind of a decrease. A lot of that has to do with Winnebago. So when I looked at the specific revenues, so mental health outpatient, our MD, those were the same. The Winnebago really fluctuates depending on what collections they've made and the timing of when they get sent to us. So then CCS looked good, economic support. If we go to page 56, a couple of things I just wanted to point out with children's services. On our revenues, we see a new human services line and then our YCSS revenues. That's our children's long-term support. And what I did is I broke out the case management revenue from purchase services that we provide at St. Croix County or pay for at St. Croix County, and then we submit to the third party. So like respite care, some of home modifications, they're not able to bill directly to WPS, so we pay them and we submit it. And just for reconciliation purposes, I needed those split out. When you go down a little bit to our purchase services line, so again, comparing 2022 to 2023, a huge jump in that purchase services. So I was just going to give you a little bit of breakdown. So in our children's services, again, we have multiple departments that all roll up into this department level. So 34,000 of that increase was in birth to 3. So we do contract with outside providers to provide some of our birth to 3 therapy. So there's a big increase in that just because of the additional need that we have in birth to 3 enrollments. 127 was directly related to child protection services. That was a placement that started September of last year and is continuing. It's an out-of-state placement, so it's about $30,000 a month. Children's long-term support, that had $67,000 of that increase. So again, that's fully reimbursable. So part of this increase in purchase services will be covered by additional funding that we receive. The big impact was in our juvenile justice program, so that was $269,000. I did meet with our children's services administrator, and it's just really placements now related to delinquency. So we have a placement in corrections, we've had multiple secure detention placements, and again, those are very expensive. So we did budget additional money for some of these, but just, you know, in comparison of last year to this year, which is a lot of what I'm looking at, wanted to provide that explanation to you. So if we move on to the health center campus, and we're looking at page 64, just wanted to finish on some good news there. Healthcare campus as a whole is currently in the positive, so both nursing home and Orchard View. And we are expecting our settlement dollars to come in here in June too, which is about $200,000. So that'll be from our Medicaid cost reporting. So any questions regarding human services or the healthcare campus?
Doesn't look like it.
Okay.
Thank you. Next item is consideration of capital improvement projects for HHS and HCC.
That's mine. It's a 5-year capital improvement plan. There's about 7 or 8 items to go over. That's rated the HHS. First, in 27, fiscal year 27, we'll be replacing a generator. And then the landscaping design and the architecture that has gone on this year, we're also putting $55,000 in for fiscal year 24, and then another $80,000 for fiscal year 27. We'll be replacing the nursing home hot water plant replacement, $300,000 in fiscal year '27. Nursing home grease trap, which doesn't exist at this point. Truth. It'll be $30,000 in this next fiscal year. About $15,000 for converting from carpet to the LVP plank flooring. Down in the IT area, $500,000 for replacing cameras that are way out of what we want to call, they can't be repaired, they can't get the, so I'm not sure how much of that 500,000 goes to the healthcare campus. I'm not sure, part of it goes to the jail and part of it goes to there. And the final item on here is on the next page. And these are replacement vehicles for ADRC. $45,000 for the first 4 years, and then $88,000, and that's for the bigger van to be replaced. Any questions?
Everybody's silent. Go ahead, Kathy.
Well, I think we'll be talking about this in July at our committee of the whole. So this is informational and it's good.
Yeah, it's information. We wanted to present it to you before that meeting.
Okay, perfect. Thank you.
No other questions? Everybody's good with spending money? Good.
Yeah, there's not one there, so.
Yeah, we need a grease
At
trap.
least that's what they told me. I didn't go check it out, so.
Keep it lubricated. So, thank you.
You're welcome.
Updates from Health and Human Services. Any updates?
Yes, I have some updates Bob had prepared. So he wanted us to just recap our second annual Health and Human Mental Health Symposium, which you all were at. And there were approximately 70 people that were in attendance. And it was held at Northwoods on May 17th. The River Channel recorded the event, which is available on the St. Croix County website. Anecdotal reactions to the event were very positive. Public Health will be working on developing an ongoing public health campaign to further educate the public on addiction and help to change public perception on addiction disorders, reduce stigma, normalize addiction and mental health conditions as part of our health and healthcare system. I had actually had a staff from Northwoods reach out to me, actually the health nurse who was just absolutely, she was very impressed by the presentations and all the speakers. And she reached out to me and we met and we talked about the services that we provide here at St. Croix County, and she wanted to look to figure out how we can collaborate since they're literally across the street from us. So that was awesome. Withdrawal management, Ailey spoke just briefly about this, about our partnership with Western Wisconsin Health. We have the initiative in an outpatient withdrawal management service. The project seeks to better engage, assess, and treat persons presenting to the hospital with severe addiction or acute withdrawal needs. The medicated assisted treatment, or MAT, options will be available to participants along with other drug monitoring at a weekly physician-led clinic held at Western Wisconsin Health, with behavioral health staff providing additional support. So we have a peer support specialist who is directly involved, and we have one of our substance use counselors who is providing some of the screening pieces. The HHS Sheriff's Office MAT grant, also within the jail. So currently we have 2 HHS staff, 3 HHS staff who are directly involved in providing the service within the Sheriff's Office, within the jail, with the MAT program within the jail. We also have an additional program that the current one I think is done. It was extended, I believe, till the end of August. It was I think first was the end of June, and now it's extended through the end of August. There's an additional grant that Ellie Clausen is writing to is a medicated-assisted treatment option for inmates transitioning from the jail to our communities. Ellie's working with the sheriff's office to submit the grant proposal for funding for later this summer. The grant would support medication and personnel costs related to the provision of Vivitrol and naltrexone. Those are both medications that help to reduce cravings and euphoric effects of opioids and alcohol, and coordinate and assist participants in further recovery efforts. So it's really taking what we have, the sheriff's office has right now, and expanding on it and adding a little bit to it. So hopefully we'll be able to get that and continue that program. I think the last report from Kathy Borgschatz is they've had like 40-ish people go through their MAP program within the jail, which is amazing. Substance use and mental health supplemental block grant funding. So our HHS Behavioral Health Division has proposed using block grant funds to support the implementation of mental health and substance use prevention efforts within the St. Croix County schools. So I was able to designate some funding. It's a program called Cognito, and it's kind of like a avatar, like game-ish thing where students can actually walk through social situations. It helps them, it gives them feedback while they're doing it, so it can teach them refusal skills. It also has an option of teaching teachers how to talk with students and having those really complex, uncomfortable conversations. And it's something that we have, the 4 schools right now that are participating are Baldwin, Somerset, Hudson, Hudson, who am I forgetting? No. New Richmond, thank you. Because they all have mental health navigators, because this requires somebody from the school district to actually facilitate it. In our next grant request, I had put in to also include Glenwood and St. Croix Central. The problem being is they don't necessarily have that dedicated person to do it, so we'd have to maybe help a little bit more in getting that facilitated. So it's actually, for me, a really fun initiative because they are so excited. First of all, they have the kids and they have the prevention opportunities, and so it's a place that I think we've traditionally had a really hard time addressing, and with this partnership gives us an opportunity that we really haven't been able to pursue in the past. We're also using some of our prevention funds to continue to train and distribute the Narcan and the fentanyl test strips. The Chief Justice Summit on Mental Health, that was held on April 21st in Madison. Chief Justice Ziegler of Wisconsin Supreme Court initiated this statewide conference in Madison as a follow-up to the state court's response to mental illness regional state summit that was held in Vermont that Bob attended last year. Representatives from St. Croix County included Judge Waterman, Phil Gawley, Sheriff Knutson, Chief Young, myself, Bob Brewitt, and Jillian Gustafson from Western Wisconsin Health Emergency Department. The conference focused on systems change to better address the behavioral health needs of persons with criminal justice involvement. The CJCC Behavioral Health Subcommittee is using some of that information in the summit to regionalize some of the things that they learned in Vermont as well as in Madison. Kind of a spin-off to that too is we were able to fund a 10-person team to participate in a law and mental health conference. The title is Mobile Crisis Alternatives to Police, including law enforcement, corp counsel, behavioral health, administration, and justice services, and that's really a focus, again, very similar. Is there ways that we can divert folks from jail and some of those other efforts that have been successful in other areas to help get upstream and get people assistance before they end up in our justice services system. And lastly, the Health and Human, Kelly just touched on this, the Health and Human Services Strategic Plan, using St. Croix County Strategic Plan as the foundation. HHS leadership participated in a series of strategic planning sessions facilitated by the University of Wisconsin Extension Office. There was a series of three-hour sessions resulting in the development of a new vision statement and with specific goals outlined under each of the 5 identified areas. Input was gathered from Health and Human Services staff, board members, and the county administrator, and discussed and reviewed at the scheduled sessions. Final version will be presented in July.
That's all?
That is all. See, I'm much quicker. I talk quicker, right?
Any questions? No? Thank you. Oh, go ahead, Sean.
Can you email that list or something? About that?
Certainly,
Yeah.
I can, do you want to put it in? Yeah, I'll get it to Colleen.
Awesome. Thanks.
And that symposium I thought was very good also. Thank you. Thanks for doing that.
Thank you. I thought it was, I had so much positive feedback from people, like just blown away by the information provided.
Well, even Dr. Anwar was great.
Yes, absolutely. And also from we had vendors come and we had 16 tables of vendors, which was fantastic because all of those people didn't even realize each of them had, what was in our community. So that in itself was really good.
Yeah. Thank you. Requests for future agenda items. Anybody has any requests to be put on the next agenda or sometime in the future? Nope. Okay. Let me know if you do, or Bob, or anybody. Any other announcements or correspondence? No? Okay. 6:26, we are adjourned. Thank you, everyone.